Hey everyone, I'm here with Mr. Dong, our traditional acupuncturist, and Hannah, our sports and remedial massage therapist. And today we're going to talk about headaches, hopefully what we look for in the patient, and then how we'd each go about treating them individually. Um, so, me personally, I see a lot of patients with headaches, especially more recently with working from home, stressful lives, commuting, all stuff like that. It's a big proportion of what I see in the clinic. Mr. Dong, what do you tend to see?
Yeah, obviously headache from the Chinese medicine. We normally, when we look at any problem, we try to from different angle, different level to talk about problem. Uh, Something similar is use the physical level. Some kind of, for example, for the headache problem, most people have a neck problem, so we need to do something for that. And Chinese medicine more concentrated is for energy. We talk about meridian lines, all this kind of diagnosis is basic on energy drop. Basic Chinese medicine basic idea is a pain normally is a block energy. So which energy blocked? We need to identify where the blockage and then we do some treatment for it. On top of the energy level, obviously we still have this kind of surgical level, spiritual level headache. That still happen. If you think about you hate someone, you think about him, you will have headache. So we need all three levels to talk about. Found different energy, different cause for this, and we do the treatment for it. How about yours?
I tend to, mine crosses over a little bit. We tend to see people have massage for headaches if they are of a stressful nature and things like that, and everyone's feeling very stressed at the moment, or from a very purely physical point as well. So we massage sits quite nicely in between the two of them, and I tend to find that my treatments evolve depending on what presentation it is as well. So if someone is coming in feeling very flustered and just there's lots going around their heads, it's a treatment very much about settling and calming and everything like that. Or if there's a very definite to go, yes, those muscles are really holding on, let's do what we can to try and let them go.
Yeah, I probably do a lot of similar stuff. I think everyone thinks a lot of what we do is very physical. So, we dry needle muscles, acupuncture them, massage, we do manipulation, articulation. It's all very physical, but actually a lot of what we do, I think, with headache patients is taught them understand maybe their lifestyle more, so we can understand their problem. And if we can understand their problem more, we can really get to grips of why these headaches might be happening. A lot of things come out as physical, so tight muscles, sore neck, stiff joints, but are they under a pressured lifestyle? Have they got a job they're struggling with? Have they got a difficult family life or something like that? And that's causing tension through their body. So although it's very physical, it's talking about that lifestyle side of things as well. And in terms of physically what we look for things that can produce headaches, neck dysfunction, so stiffness and soreness in the upper joints of your neck, which commonly refer pain onto the front of the head. So you're looking for soreness in the upper part of the neck, and in the trapeze is probably similar to what Hannah looks for. You can look a bit more holistically, so you can go down through the middle of the back, upper back into the shoulders. The shoulders and the neck connect as well, so you can look all the way through this whole big complex of the body and try and really work out not so much in what Mr. Dawn calls about as a blockage, but almost like the movement blockage, why they're not moving well, what's blocking this movement pattern. What about yourself? What do you look for when you meet someone?
I think obviously it looks from all three different preferences, it looks similar. Obviously you're talking about the lifestyle or this cause for this headache. It's like I'm talking about surgical or spiritual top level, and you talk about the muscle neck problem. It's same as all of us, this kind of physical cause trouble. The different maybe Chinese medicine with your guys maybe we try to create a model of something in middle, the energy level. We do acupuncture on the meridian lines, obviously. Just we try to use this kind of energy channel to link the surgical level and physical level from the middle to sorted all these any troubles.
Yeah.
Obviously, the cause looks similar.
Yeah.
Similar idea for this.
Yeah, I tend to see almost if someone's coming in for the first time with talking about headaches, it tends to be you kind of I tend to look at the bigger picture first almost, and then you can try to focus it down. So someone might come in saying, oh yes, it's very definitely this bit, but you kind of sometimes need to expand out from there. You go, well actually, is that coming from up in the head, or is it coming, as I said, a little bit further away in the back? And my approach is trying to create space and ease within the body, so that might not necessarily, yes, of course, we'll always work on the spot that's hurting, but then you'd also work elsewhere to create the opportunity for better movement, for ease of that tension, to make it more incorporated within the body.
I think the great thing about any manual therapy or holistic therapy is you have free reign to do what you need to do. There is no right or wrong way to treat headaches. And actually, I think in combination you can really try and tackle every level. Me personally, I tend to work on the same principle as you. It's mainly movement related medicine, physical medicine, mobilizing joints, releasing tight structures. But as Mr. Dong said, they are uniquely related. Why that is in modern medicine, I don't think we know. But if someone's having an emotional time, I've seen it before where you release that neck and release that headaches, and these patients then have a bit of a they come back and they said, actually I was really tired or really emotional afterwards, and actually it released a lot of stuff. And are you purely just releasing that muscle, or are you releasing something
More than muscle.
more than that muscle,
More than muscle.
but it's being held there. And they're the really interesting ones. And I think now more than ever, I think we're just seeing loads of that. With I just think this increased stress over the last couple of years. In terms of treatment, Mr. Dong, what is your treatment involved? Obviously, mine's very manipulation and massage now, and I do acupuncture. And one thing everyone always asks me is, what's the difference between you and me? And I'd say I do medical acupuncture, so I'm sort of targeted dry needling / trigger points. I'm looking for the tight muscle. I'm looking for that portion of the muscle tight, and I want to release it. And the best way to do that is with an acupuncture needle, and that really causes the nervous system to release painkillers and muscle relaxants, which releases that muscle. That's the way I use my acupuncture. How would you use yours?
Exactly. We last time we talked about this different with the two different acupuncture. Looks obviously when you do this, which called Western acupuncture, you're more about this trigger point, the north side.
Yeah.
Which Chinese medicine is still doing that. We call it ash point.
Yeah.
The ash point is a very big point. Can be anywhere.
Yeah.
What means ash point? Translate to English is like a yes point.
Yeah.
If you push anywhere, oh, pain, yes, that's it. That's the point.
Yeah.
So it's exactly the trigger
Yeah.
point. The yes point can treat all different this pain problem.
Mhm.
So you stick a needle there to release the nose, release the tension there.
Yeah.
But for Chinese medicine, that's one method.
Yeah.
We do that. But we more concern is the distance. If a channel, we say one side blockage, that's the north area. We try to, like a river, treating the top part. Where is the things all come from? It's like holistic. You talk about the whole body. Like you take this trigger point maybe on the neck, and then a middle of your back, you maybe have some troubles. Or you're talking is about the holistic of physical of a muscle.
Yeah.
They are a whole. For me, I more talk about the whole body, the energy as a whole.
Yeah.
So, for example, when some people came here for headache, a lot of time, obviously after I check this kind of physical neck problem, I always ask them a lot of questions about when did you start? When that time, what happened? Was it emotional or all this kind? We try to find in that time the damage, which energy wrong.
Yeah.
And then we tracing back the muscle we put together, give a holistic picture.
Yeah.
Which channel, which muscle, all causes, and then accordingly we do different pump for it. So
Yeah.
your side.
Very similarly, again, you're looking for the specific restrictions of movement and the physicality of it in terms of what might be holding on. But then, as perhaps treatments develop, or if you even in this course of this one treatment, or over the second or third, as that person becomes a bit more familiar with maybe what's going on, maybe they start to discuss a little bit more about some of the psychological elements and other stresses, and sometimes purely saying that helps release some stress in the body, which helps the muscles relax. So it's all these cumulative effects, as well as very definitely targeting and creating the opportunity for muscles to move nicely. It's, I think, yeah, there's lots of layers, and people will come in for one thing to begin with, and then you go, okay, yes, that's letting go, and then you go on to explore slightly different steps of it all.
I always find it really amusing because we're all working on these different levels. We've just got different ideas of kind of what they are and the names for them, and also how
they
we
go
try
to
and
thing.
impact. Yeah, so we're all treating the same thing. We're just going about it in different ways, and this is one of the great things about what we do is there is no sort of right or wrong answers.
And then that's really nice, because if someone's found that one treatment hasn't worked particularly well for themselves, there are alternatives, and
Yeah.
there's different ways to approach it, which is really nice.
I think if we face a very challenging problem, maybe we can work together
Come
to
together.
find exactly
Yeah.
the way it is.
At the end of the day, it's about providing the best solution for the person who's in front of you. And if that's not me, then I want them to try maybe some Chinese medicine to see if that helps. And if that helps, then that's fantastic. That's the aim. Or maybe some massage will help. And it really depends. And everyone is so unique, so it really does depend on what they actually need.
Yeah, for our patients, we work together, we can find more problem to help them. And for us, we can learn from each other to fulfill all the technique, the different sides to do more better job.
Yeah.
I hope you found that really useful. I really enjoy these conversations. Getting to understand what everyone else does, and it always surprises me how I think similarly we work, but also on such different levels at the same time.
I think we need to do more talk. Obviously, if you're two different professionals, it's like if you don't talk, it's like you are in both sides of the mountain.
Yeah.
You don't nothing. You look very heavy. You don't know each other.
Yeah.
But if you talk, it's like just a paper. You put through all clear, all same.
The more knowledge we have, the better we can do.